One of the things that our founder, Kathy Penapeno, always talks about is the good death. And it seems counterintuitive to talk about a good death, but that's really possible when you can meet the family and meet the resident, the individual where they are, and make sure that their remaining days are living as opposed to dying, where we're making memories, where we're helping them build legacies. A Crossroads House is really a comfort care home. The difference with hospice is hospice requires a diagnosis of 6 months or less, whereas Crossroads House in the comfort care home situation requires a diagnosis of 3 months or less. And we are strictly focusing on the comfort care. The person and the family have made the decision together that they're not going to seek any more heroic measures. They're not going to seek any more treatment for their disease. They're going to be kept comfortable. Some are bedbound at that point, some are in a wheelchair, some are completely mobile and go in and out of the house as they please. You know, we have residents that will go to the casino and play the slots for a couple of last times. It's about the living process as opposed to the dying process. When someone comes into Crossroads House, we have an emerging program here called the End of Life Doula Program. And we will have a doula that will meet with the family and the resident and find out what their needs are, whether it's spiritual, emotional, physical, what their likes and dislikes are, if there's any bucket list items that we might be able to help them accomplish. And then we formulate a plan for what's the best way for our Crossroads House staff and volunteers working alongside the family to create the best end-of-life experience that that person can have. I had had some prior experience through the Department of Corrections. I was an Employee Assistance Program Coordinator as well as an officer. And in that role, I had gotten some training in different areas of grief response and in particular critical incident stress management, which is a process that is a debriefing process for those that are responding to difficult incidences. In that role, provided debriefings for officers and employees who had been exposed to traumatic events on the job. And I took some additional training in what's called International Disaster Management Family Assistance. And that's when I became a consultant for a company out of Houston, Texas, to respond to international disasters. And the first call out in that role was 9/11, was the terrorist attack in New York City. Our team was tasked with providing family assistance for the employees or the family members of employees who had lost loved ones at the point of the first plane and the North Tower. One of the things that in the call-outs, and they've been in different cities across the United States, different countries around the world, is that grief is not only different culturally, but it's very intimate and it's very individual. And you know, when you think about Crossroads House history over 22 years, we've served over 530 residents and their families. And in each one of those situations is a very individual grief process. It's a very intimate grief process. And it's important for volunteers and staff to understand the differences in the grief process that the people are going through and to meet them where they are in their process. You know, we talk about large numbers. 9/11 was 3,000 victims. The tsunami was tens of thousands of victims. But in reality, each one of those was an individual grief experience for those loved ones. It was a singular grief experience. And that's what we have to focus on, making that grief experience an intimate and even a positive experience for those that are going through it. Because we don't charge for our services, we don't take any state or federal aid, and we don't accept any insurance reimbursement, every dollar that it takes to run Crossroads House has to be raised in the community. And we do it through event-based fundraising, we do it through private grants, and we do it through our mail campaigns to individuals and to businesses. We always need to build our volunteer core. Volunteering has ebbs and flows just like everything else. People get busy. Volunteerism as a whole seems to be waning in our society, so we need to build our volunteer core up, not only for our resident care volunteers, but all of that support that it takes to run Crossroads House. So we certainly are in the 24/7 business of recruiting and getting more people in here to help out Crossroads House. This is number one in personal fulfillment. Being a retired state employee allows you to go into the nonprofit sector, which you don't go into the nonprofit sector to get rich, but you get into it to get rich in the rewards of life. In the 6 years here, it just innumerable experiences where you usher a family through that end of life process, and to have them come back and say that it was a positive experience having their loved one here at Crossroads House, you can't put a price on it.